even as we're getting the number of cases that are increasing in the country and we've crossed the 5,000 mark at this point, there is further resolve to strengthen the fight against coronavirus. And for this, the Indian Council for Medical Research, they're expecting at least to get 5 lakh rapid testing kits to test all the clusters and the hotspots, the areas where a large number of cases have been reported and the number of deaths have also been reported from those areas. Now, the ICMR also expecting the fact that more than 7 lakh rapid testing kits, which remember have been ordered by India, which is supposed to be delivered in a phased manner at this point. Now, these of course are important because these tests are going to be conducted to further strengthen the fight against coronavirus and to increase the testing capacities at this point. Going to my colleague Ayushman, getting us those updates there. Ayushman, with the ICMR expecting to get at least 5 lakh rapid testing kits by today, tell us about the standard operating procedure that has been laid down at this point to conduct these rapid tests.
Well, Apurva, if you see right now, today is the day when ICMR is expecting 5 lakh testing kits. So these are the rapid antibody testing kits which the ICMR has procured, and we are expecting that 5 lakh kits will be available to ICMR. If you talk about the standard operating procedures, the state governments on their own have been also procuring these rapid antibody test kits, and with the help of the IDSP, the surveillance program which is there in the COVID-19, the areas will be identified where the positive cases have come, and in those areas the government officials, the health officials will go, they'll be taking precautions, and they'll be going and taking all those people in consideration who have influenza like illness. Their samples will be taken, and once the sample is taken, they will be told to go in quarantine, and immediately after 30 minutes when the samples result come, if they are found out to be positive, they'll be immediately told to go to COVID-19 dedicated hospital. If it turns out to be negative, because they are hailing from a community where positive cases have been found and they are also witnessing influenza like illness, there'll be a reverse transcriptase polymer chain reaction test also. If that also comes out to be negative, 10 days later again the same rapid antibody test will again be conducted to again confirm that that person has does not have any COVID-19 symptom, and meanwhile in those 10 days he'll be told to stay in quarantine. If again that test comes negative, then he has got no infection, otherwise he will be sent to the COVID-19 dedicated hospital if found positive. So this is the protocol that the ICMR has given to the state, and they will be following it. This is what we have been told. At the same time, if you see in Delhi yesterday, Satyendra Jain told us that 1 lakh testing kit have come, and 2 of the areas, Nizamuddin and also Dilshad Garden, are the one where the government is going ahead with the rapid testing and trying to ascertain if people there have not contracted the disease.
All right, Ayushman, many thanks for joining us and bringing us all those updates and the standard operating procedure that has now been laid down at this point to conduct these rapid testing at this point.